Role of health and social care workers. Care worker. A care worker works with people who need direct care and support, and is responsible for an individual's overall comfort and independence. The care worker works in a residential or nursing home, in people's own homes, or out in the community. A live-in carer lives with an individual over a specified time period. No 2 days are the same as a care worker, but the role often includes supporting people with social and physical activities, helping with personal care such as support with showering and dressing, monitoring people's health, for example by checking body temperatures and fluid intake, helping people to live as independently as possible. Activities worker. The role of an activities worker would be to design and oversee activities for people who need care and support. This could be in a residential care home, a community care setting, or in an individual's home. The activities stimulate new interests and skills, and are designed specifically to meet individuals' needs. The role often includes talking to people about what activities they like to do, developing and providing activities for individuals and groups, booking external suppliers to provide entertainment, organizing trips out in the local community. Rehabilitation worker. The role of a rehabilitation worker would involve supporting individuals to live as independently as possible, often following an illness or accident. Rehabilitation worker supports people with many aspects of their everyday living, including personal, emotional and social care. The role often includes doing specialist assessments to identify what care and support people need, working with other professionals such as social workers and housing support to help people, teaching people life skills such as making a cup of tea, cooking or reading Braille, organizing activities such as sports, drama or educational activities. Advocacy worker. Advocacy seeks to ensure that people, particularly those who are most vulnerable, have their voices heard on issues that are important to them and have their views and wishes genuinely considered when decisions are being made about their lives. In this role, the advocate empowers individuals to express their views, wishes and choices and remain as involved as possible in all decisions which affect them. For example, advocacy might be needed for someone with dementia. As part of the role, the worker must support them in making decisions about getting carers in their own home or moving into residential care. Complementary therapist. This role includes providing complementary therapies such as reflexology, massage and aromatherapy to individuals who may be experiencing emotional distress, pain or psychological issues. Work may be based in a hospital, health center, hospice or in someone's own home. The role could include doing assessments to identify treatments for people, delivering complementary therapies such as reflexology, massage and aromatherapy, evaluating the therapies and amending treatment plans when needed. Housing support officer. A housing support officer provides housing-related support and advice to individuals, to help them live independently and maintain their tenancy. Workplace may include sheltered accommodation, supported living services, a hostel for the homeless or supported housing. A beginner may be working as a residential warden, ensuring a safe and secure environment for all residents and acting as the first point of contact for care staff and contractors. This role could include assessing the needs of people who need housing, supporting individuals with many aspects of everyday living, including personal finance, cooking and shopping, carrying out inspections and health and safety checks, working in teams with other professionals such as social workers to make sure people get the right housing and support, providing advice and informal counseling when necessary. Commissioner. A commissioner arranges services for people who need care and support. Commissioning funds and services such as therapy, or work with particular client groups such as older people or people with a mental health condition are all part of the role. A commissioner can work for a local authority, a clinical commissioning group or another NHS service. There are a range of roles within commissioning teams, including quality assurance and compliance. The role could include finding services that people who need care and support can use in the local community, researching information on best practice, national policy and legislation and local market intelligence, planning and doing visits to local care providers to make sure they're delivering good care services, writing contracts and carrying out assessments. Management. There are lots of different jobs which fall under the management category in adult social care, from being a supervisor, senior PA or team leader, to being the CEO of a residential care business. Supervisors have some responsibility for the quality of care an organization provides. They supervise the work of other care and frontline workers. First-line managers are responsible for the day-to-day provision of social care services. This means they support the staff and have a key role in ensuring that the standard of care delivered is always high. Typical jobs in this category are team leaders, service managers and residential wardens. Middle managers are responsible for overseeing the organization and managing whole departments. Examples of their duties include determining staffing requirements and managing budgets. Workers in this category could be area managers, managers or department heads. Senior managers have overall responsibility for the organization, and their main job role includes giving the organization leadership and direction. They have final responsibility for the quality of care provided and the health and safety of staff, people using care and support and any visitors. Senior managers could be owners, directors or chief executives. Doctor. A doctor is a medical professional who provides care to patients. Doctors diagnose, treat, and counsel patients who have illnesses, disorders, or injuries. Their many responsibilities include patient examination, data collection, diagnostic testing, and direct illness treatment. Healthcare worker. Anyone who works in a healthcare or social care context is considered a healthcare worker, including healthcare students on clinical placement, frontline healthcare professionals, and those healthcare workers who do not have direct patient contact. These settings include, but are not limited to, state-funded and private organizations that provide services in the following areas: disability, older people, nursing homes, acute and non-acute hospitals, community hospitals, mental health, social inclusion, palliative care, chronic illness, primary care, GP, dental, pharmacies, physiotherapy clinics, health and well-being, hospice, rehabilitation, and rehabilitative care, for example youth, substance abuse, suicide prevention, community development. Social workers. They provide advice and emotional support to help people adjust to changes in their lives, caused by illness, age-related problems, disability or bereavement. They may also work with people who suffer from mental illnesses like depression, anxiety, schizophrenia and personality disorders. Your job would be to work out what type of care and support is needed, and visit people to reassess their needs over a set period of time. You would usually work as part of a team, responsible for a number of cases which all might need a different approach. You also need to work closely with organizations such as the police, health services, schools and probation services. Social care worker. Social care workers provide practical and emotional help to a diverse spectrum of clients. They frequently work with individuals, families, and communities to safeguard and promote people's well-being so that they can have a higher quality of life. A social care worker delivers services under the direction of a certified social worker or case manager, frequently in collaboration with other health or social care experts. Occupational therapist. Sometimes referred to as a NOT practitioner or therapist for short, this role can work with people who need care and support in the following areas: physical rehabilitation, mental health, learning disabilities, care management, equipment for daily living, housing. You would work with people to overcome the effects of their disability, and assess what treatment or equipment is needed to increase their independence. This could be physical treatment to improve their mobility, or advising on equipment they need or the design of people's houses. For example, you would give advice to housing departments for a person who uses a wheelchair. Registered nurse. To become a registered nurse you should be fully trained and have an official certificate. As a registered nurse in adult social care you could work in a nursing home or out in the community. Nurses in adult social care can work in the following areas: caring for adults, elderly people and others who are ill, injured or have physical disabilities. Working with people who have learning difficulties to help them become as independent as possible. Community psychiatry and other psychiatry, mental health. Nurses help people suffering from mental health problems, for example personality disorders, neuroses, phobias, acute anxiety, alcohol dependency, severe eating disorders and depression. Support roles. Administration roles are not specific to care, but larger care and support services have many roles available within an office environment, and might include personnel and human resources, HR, receptionist, finance, IT, marketing. Ancillary job roles, which are not specific to working in care but are vital to providing a good service, can include any of the following: domestic and cleaning staff, catering staff and chef, driver, maintenance, handy person. Pediatrics. Pediatricians are doctors who manage medical conditions affecting infants, children and young people. Pediatrics can be divided into 4 main areas. General pediatrics, a hospital role covering children from birth to the age of 16. Most pediatricians have this generalist role. Neonatology, this role specializes in looking after newly born babies. It is usually based in an intensive care unit looking after premature babies or those with problems at birth. Community pediatrics, these doctors are based in the community and look after children with developmental, social or behavioral problems and those with a physical disability. Pediatric cardiology, this is a small area which is a specialty in its own right. These doctors diagnose and treat children with cardiac, heart, conditions. Geriatrics. Geriatrics is the branch of healthcare that focuses on our unique needs as we age. Just as pediatricians specialize in the health needs of children, geriatricians specialize in the health needs of older people. Geriatricians also often work with a whole team of fellow geriatrics health professionals, including nurses, physician assistants, pharmacists, social workers, and many others. Maternity care. You may be surprised to know that being fully engaged in your maternity care can make all the difference in the care you get, your experiences and the well-being of both you and your baby. Having the skills, knowledge and confidence to wisely navigate your maternity care is important because the quality of maternity care varies a lot across providers and care settings. The care arrangements you make affect what happens to you and your health. There is broad agreement that cesareans and many other maternity practices are overused and can cause needless discomfort and harm. Becoming informed and following proven tips can help you avoid these problems. High-quality research points to many safer, more effective practices for you and your baby. But it can take many years before these practices are reliably provided to women and babies at the point of care. Knowing about and seeking best practices can make a big difference for both of you. Your baby is counting on you to advocate for her or his best start. You are embarking on many years of responsibility for managing healthcare across generations. Pregnancy and birth is an ideal time to develop skills, knowledge and confidence for a lifetime. You've come to the right place. The consultant. Consultants are doctors who have undergone higher specialty training, typically 6 to 8 years following registration, to enter the specialty register. The roles are: consultants work primarily in the delivery of expert clinical care, often within a team. Their workload commonly involves managing the more complex type of cases, in terms of diagnosis and management decisions. They also often manage apparently simple cases which have a high incidence of complications in more inexperienced hands. Consultants are also involved in a variety of other roles including general running of departments, making managerial decisions, teaching or training, research, developing local services. Nurses. A nurse is a healthcare professional who is focused on caring for individuals, families, and communities, ensuring that they attain, maintain, or recover optimal health and functioning. Nurses are capable of assessing, planning, implementing, and evaluating care independently of doctors. Some nurses undergo additional specialty training within their clinical area, for example emergency nurse practitioners, advanced care practitioners, specialist nurses. Matron or lead nurse. The main roles of the matron or lead nurse include: to ensure the highest standards of nursing care are delivered by providing leadership to professional and direct care staff. To ensure that administrative and support services are designed and delivered to achieve the highest standards of care. To provide a visible, accessible and authoritative presence in ward settings, someone to whom patients and their families can turn for assistance, advice and support. Nursing sister. The main roles of nursing sisters include: to be a clinical nursing expert, To manage and lead the ward nursing staff team and the ward environment. To provide education for nurses, other healthcare professionals, patients and carers. Staff nurses. The main roles of staff nurses include the assessment of a patient's needs and to plan, implement and evaluate evidence-based nursing care. To provide healthcare advice through educating patients, carers and families. To carry out clinical nursing procedures. To work with other members of the health and social care team. To supervise other junior nursing staff and students. To contribute to the delivery of good practice by participating in teaching and learning opportunities. Thank you. See you in the next lesson.